Hello,
Can you hear me? Good morning.
good
Good to see you.
afternoon.
Good morning. How are you?
Yeah, once more we are able to connect.
Eventually, yeah. We are.
The the link is quite difficult.
Oh, yeah. I've tried it
Yeah,
like 3 times. Yeah.
yeah. And tracking you down is
A little bit challenging. That's true.
yeah. It shows that you are doing good for yourself.
Thank you.
You
I
know,
know you
last
did.
time with life hard drugs,
Hmm.
but today I said we'll be clinical drugs and drug addiction.
All right.
Clinical drugs. So, and if we want to get it right, when we talk about clinical drugs, we have drugs that is originally meant to heal us. But sometimes these drugs are also becoming problematic results affecting the mental health of youth and even adults. And that's why we have decided to discuss on that. And why, because the other time, you
Right.
were surprised that a lot of questions come up. And
Right.
I feel that those questions you may there are so many of those questions that are quite funny that you time you also answer those. Thank
Sure.
you.
Yeah.
Introduce yourself to our subscribers.
Good morning from this side of the world. My name
Mm.
is Femi Duyilemi. I'm a registered nurse in few countries of the world, and I'm adjunct professor of a university here in Texas, teaching mental health. Um, have long experience in mental health, over 40 years from the beginning, which was in the Neuropsychiatric Hospital, Arrow, Abeokuta,
Mm.
Nigeria. And since then, I've been able to practice in different parts of the world. As the host will tell you, I'm a transcultural mental health professional. That's what I would call myself. I had experience working in Europe, in the Middle East, in Nigeria, and in North America in general. I'm glad to be here
Okay.
today to
Thanks. Thanks. I would like to ask you when we are talking about clinical drugs, what do you understand about clinical drugs?
what I know you're talking about is what we call prescription drugs. Pre-
Yeah.
Prescription drugs abuse and prescription drugs addiction.
Yes.
These are medications that are initially prescribed by a medical professional to for a purpose of helping us in some ailment. But
Mm.
some of this medication, not completely due to our fault, in those days we didn't know that some of these medications can easily uh, cause a form of addiction. But
Okay.
nowadays, we find that yeah, a lot of people get addicted easily. So the practice have
Yeah.
changed how they prescribe them. So some of
Okay.
this medication include the medication we use for pain, some that we use to feel relaxed, some of them we use just to help us sleep when we have difficult time
Mm.
sleeping because of a life event or because of other issues.
Okay. 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 But how can something which is normally for good become something for bad? You get what I'm trying to ask.
I understand.
Normally, the doctor has prescribed it for you to get well. All of a sudden, you are having mental issues from it.
from it, initially, I mean, we have two categories of abuse progressing to addiction when it comes to medication that we use for normal stuff. I will give you
Mm.
an example. Let's start with the easiest ones. These are the one that we
mm,
call the over-the-counter medications. Over-the-counter medications are the medication you can walk into a pharmacy or a drugstore, a chemist, we
mm,
call them, and you can take when you talk to the pharmacist or the chemist and say,
mm,
"Hey, I'm having some problem with my tooth. Please give me some
mm,
medication." They will say, "Okay, buy some paracetamol. Okay, buy this." Some of the paracetamol and some of this pain medication over the counter, some of them have some combination, sometimes a little bit of other medication in them. For example, you see paracetamol with a muscle relaxant like ofenadrine, and
mm.
when you take it, it makes you feel good. That those are not prescribed from the doctor, but they are the ones you can get over the counter. And these
Okay.
medications as well, people abuse them a lot. They abuse them a
Okay.
lot. Once they know it work for them, then you start taking it. Whenever you have pain, you take it. Whenever you have pain, you take it. Then your body get tolerance, develop tolerance to it. And then it
Okay.
gets to a point that you cannot do without them. Some people will even take them on daily basis,
Okay.
which you are not supposed to. So when you start taking them like that, some of them might not never cause you what they call physical dependency. Okay, but they
Okay.
cause you what we call psychological dependency. So people will not be able to do without taking them on daily basis, and that
Okay.
is addiction. But that is from
Oh,
the over the counter medication, and one of them as well is the cough syrup.
cough syrup.
Cough syrup, people take cough syrup. You can buy it over the counter when you have congestion and everything. You take it, and some people feel high on it, they enjoy it, so they keep going back to buy more, and they drink it every day. They get tolerance and they become addicted to them. And some of these cough syrup, some of them have little opiates in some in them, but I don't think we have a lot of that over the counter anymore. Yeah.
Okay. Hmm. Wow.
That,
Wow. Something which,
that's the simple one that everybody have the tendency to get addicted to it because they were not prescribed. And
okay.
there's no need
Okay.
for prescription. You walk into the pharmacy and you grab them.
Hmm. Okay. Wow. When you were talking, I got thinking and I was wondering something normally would have been quite good, and you become addicted to it. Me of what one of our subscribers asked. I know you were in Nigeria before you left the States of America and you still come to Nigeria. You would have had there's one drug, the drug quite try and remember the name, which he said it takes every day. Alabukun.
So
You
yeah,
would have heard of it. He
I
said,
know a lot.
I should ask you if he's addicted because he takes it every day.
Alabukun is not addicted, but it can give you what we call psychological dependency.
Okay.
When we talk about addiction and psychological dependency, they come hands in hands. Okay, people get addicted, they get dependent on it, but some are physical dependency, and you have some situation that you have psychological dependency. Alabukun, the base of alabukun is a salicylate. It's like aspirin in it. It's not something that is good to take every day. This person might have been doing okay because he probably take it with meals. Otherwise,
Okay.
he would have developed ulcer, peptic ulcer, from the
Okay.
salicylate that is inside the labukun.
Hmm.
He cannot do without it because it's psychological dependent on it, which is a form
Okay.
of addiction. There's not going to be physical problem if you stop taking it. There's not going to be no
Okay.
physical problem. You're not going to have increased body pain or headaches or anything like that. But
I bet.
it's already psychological dependent and we think, "Oh, if I don't take it, I will have body pain."
Oh,
So alabukun is not one of those classic medications that you can easily get dependent on. It's more
oh,
of the mind. You know, it
um,
can damage physically, it cannot damage you mentally.
oh.
Yeah.
So I want you to expatiate on this dependency and addiction. What's the difference, and can they be connected?
You see, the word addiction,
Mm,
if we go back to our discussion last time, the word
mm,
addiction, sometimes we use it loosely. But
okay,
addiction is when you are doing something in excess
okay,
that affect significant part of your life.
okay,
We can say you have developed an addiction. It could
okay.
be it could be sex, it could be drugs, it could be food, it could be gambling.
Mm,
Once you're doing this in excess and it's affecting either your job, your
mm,
finances, your relationship with people, or you're getting in trouble with the law, we will say it's addiction. When I say dependence, psychological, physical dependence, these are two different things.
mm,
As I said, psychological dependence comes from you feeling great, feeling happy when you are doing this stuff.
mm.
Can you hear me?
I'm hearing.
Okay.
I'm
So
hearing.
when you are doing this stuff, let's say gambling, okay? When
Mm,
you do gambling and you are high, you are happy about it, and you keep doing it. You remember, gambling is not drugs, but you
mm,
can have an addiction to gambling.
mm,
Because one is making you happy and you can't do without it to the extent that you are using your rent to
mm.
gamble, and then the landlord is knocking on your door.
Okay,
That's gambling addiction.
okay.
So that's addiction. Dependency. Physical dependency is that you have your body is asking for this substance from outside,
Mm,
and that would be related to drugs and medications and stuff like that, substances. Okay.
okay,
Addiction is activity, sex is
okay.
activity. You can be addicted to those activities, and at the same time, you can be addicted to substances, which is we're talking about alcohol, medication, drugs like cocaine, drugs like heroin and marijuana, igbo, cannabis, colo, all of them. Those are
Mm,
drugs. You can be addicted to drugs, you can be addicted to activities. Psychological dependence happens across all of them.
okay,
You have to be psychologically dependent before you become an addict.
okay.
So I will use the gambling again as an example. You are doing gambling, you are happy, you are getting high, you are feeling a lot happy, and you're putting all your resources into this.
Okay,
You put it because you are psychologically dependent on it. So then it starts affecting your life. Then it become an addiction.
okay,
Okay, drugs have different pathways.
okay.
Some drugs doesn't cause you. They cause you. You have psychological dependence. Then you develop. You develop physical dependence on them,
Mm,
and then it might lead to addiction. And if I say addiction, we are talking about you getting in trouble.
hmm,
That lifestyle. So let's
o-
say somebody smoke weed. Igbo.
mm,
Keep smoking weed. You are happy because it's giving you this vibe. It's giving you this, happiness and all that.
mm,
Then one will get psychological dependent on it.
mm,
Maybe you want to have a lecture or you want to go for a game that is something that's causing you anxiety. You have, you take like two puffs and you feel calm so that you can
mm,
go do what you can do. But does
mm.
marijuana cause physical dependency. No, marijuana doesn't have physical dependency. Rather, it's here. It's psychological.
Hmm.
Which means if you stop doing it, it's not going to cause you any physical problems.
Okay.
But you are still psychological dependent. Some
Hmm.
other drugs like alcohol, opiate like Colorado,
Hmm.
the cough syrup that have opiates in them, those one can
Okay.
actually make you sick, physically sick. That is called physical dependence.
Okay.
So in those cases, you are psychological dependent, you are physically dependent, which
Mm-hmm.
become a trap. Okay,
Mm-hmm.
then those one will definitely lead you to addiction. How is it going to lead you to addiction? Because you need to fix the problem.
Mm-hmm.
When you have not drank and you start having shakes and you are sweaty and all that, you need to drink to calm yourself down. And if you don't have money for drink, what can you do? You lie to your friend and borrow money.
Mm-hmm.
Then you remain in debt. When they pay salary, you can't pay your rent because you have borrowed money from everybody and you have to pay them back. That has become a problem in your relationship and in finance. So you have
Mm-hmm.
already become addicted to alcohol at that point. It's not the amount you use. It's not like, oh, he drinks every day. That's not the problem. Does it have a problem physically? Does it have a problem in relationship? Does it have a problem going to work? If I say no, no, no to that, you can be drinking every day, you are still functional. So you are not
Okay.
addicted. You might be psychologically and physically dependent, but you are not addicted yet until you get in trouble.
Okay.
But
Okay.
it's easy
I,
because when you see people that drink every day, they're the joint every evening, you say that guy's addicted to alcohol. No, if he's addicted, he won't go to work the following day.
hmm.
He won't be able to jump up. So that's the difference. That's the overlay. But we use these languages very loosely.
Yes, interchangeably.
Yeah.
From what you have explained now, I can see that we use this language interchangeably. We assume sometimes when we are psychologically dependent, we assume we are addicted. Because one of our subscribers also asked quite a funny question that he drinks Coke every single day. He drinks it morning and evening every day. Is he addicted? And
No,
from your
it's not.
explanation now, it's
It's
more of
psychological
psychological.
dependence. Yeah. Because if it doesn't take that coke, it won't have any problem that day.
Yeah.
It won't have
But
any
he said
physical
take it, it doesn't feel all right.
exactly. It doesn't feel happy. So it's just psychological dependency.
Okay. But it could cause damage. Let's don't take it out. Could cause
Physically,
damage to the body.
physically speaking, yeah, it will eventually cause you damage. But damage that a lot of sugar will cause is not going to be because of the sugar only. It's going to be because of other factors. If this person you're talking about is very active, it will burn down
Mm-hmm.
all that calorie every day. It will not
Mm.
get physical problem. But if you are not very active, you do sedentary work, you don't exercise, you don't have active type of living, yeah, it will become a problem. But if you look at
Oh,
us in Nigeria, we are very fit because many of us will jump on the bus, we walk long distance to get in the car. But you see, those people who are a little bit comfortable and drive car around and stuff like that, if they drink coke that way, they're going to have problem with their physical health.
okay. Well, it's quite educative what you are trying to let us know. And when we talk about addiction and clinical drugs now, for instance, I know a person who was taking a clinical drug prescribed by the doctor, but he kept telling those who are around him that because he had this Parkinson disease, he
Oh,
kept telling those who are around him that he hallucinates, he sees
mm, Yeah.
uh, human figures and all that. Is that part of what that drug does against that person?
Okay. I know what you're talking about. I've seen taking care of people with that experience. That hallucination is a side effect of that medication for Parkinson.
Okay.
It's an unfortunate thing. But
Mm,
what the clinician try to balance is they will try to treat that. Once you talk about it, they will give him another medication to stop the hallucination.
mm,
It's a side effect. It's not because of dependency or anything, but that's an unfortunate side effect of these Parkinson medications. But when we look
mm.
at it, the clinician have to juggle between the benefit and the harm. Okay, if the hallucination is becoming too much, they might initially reduce the medication to see if that hallucination goes away, and that little dosage can still take care of the Parkinson. Okay, but
Mm.
if that's not the case, they will keep that person the same dosage that is causing hallucinations, and they will give them a little medication that will clear the hallucinations from
Okay.
the individual. So you have to balance the gain and the positive and the negative of it. But that's a side effect. That is not related to prescription addiction or anything
Addict.
like that. That's what we
Okay.
side effect of those medications.
Okay. It's a side effect.
The side effect.
How about those who take energy drinks? Most people, some of them say, I take energy drinks. It doesn't make me sleep, and was a long time. I may not. I may just be sleeping 2 hours, 1 hour when I'm
Okay,
supposed to take 8 hours sleep. What
exactly.
does energy drinks, and he keeps going to it, which means he's getting either psychologically dependent or he's even addicted to it. Can you make a
Uh,
comment on that?
it, yeah, energy drinks have high concentration of caffeine, just like
Yes.
coffee. Okay, just like we have in coffee, just like and this caffeine is a stimulant,
Hmm.
and stimulant keep you very active, it keep you awake, it keep you going. Okay,
Hmm.
and if you continue to indulge in drinking this energy drink, you get the energy you need, but the damage is that it will start affecting your sleep as well. As I
Okay, your
said,
sleep.
your sleep, because it's a stimulant. Okay,
Hmm.
even coffee, we always advise people that look, stop drinking coffee and tea once it's about 4
Okay.
p.m. of the day,
Okay.
so that they are out of your system before bedtime. So
Okay.
whoever drinking this energy drink, we always say the same thing to them as well. Because if you drink it at 6 o'clock, 6 p.m. in the evening or 7, and you think you're going to sleep, you're not going to sleep.
Okay.
Because the content of it is caffeine, high caffeine, very high caffeine, more than what you see in coffee. And caffeine is a stimulant, they will keep you awake all night. Okay.
Then if
Some
you
people are
don't, if you
dependent on it. Sorry.
lack of sleep, would
Yeah.
it eventually cause um, effect on the brain?
Lack of sleep will damage us a lot, both physically and mentally. Okay.
Okay.
Sleep is a normal thing in life. That's when your body's supposed to rest and some cells regenerate, they reproduce and they start repairing and all that. If your
Hmm.
body have not rested, your brain have not rested, yes, there'll be ongoing problem, especially coming from the brain to start with. Okay.
Okay.
Apart
How,
from
how
you
many? Okay.
physically tired during the day, you can't function the way you're supposed to function. You are slow, you don't have the so you won't have the mental agility, you won't have the mental alertness, you won't have the mental concentration, what you need to function on the job or activity, you will lack them if you haven't had good sleep. So definitely yes.
Uh, how many hours do you recommend that you sleep?
It
How many
depends.
hours
Sleep
that
depend
the
on
body
age.
is functioning properly?
Yeah,
It depends on what?
sleep
Age.
depend on your age. Okay,
Okay.
then yeah, it depends on age. We always suggest to people or recommend for adults and young people to have at least 6 to 8 hours sleep at night.
Hmm.
Okay, but the elderly ones, people who are over 60, 65, some of them will have only 4 hours sleep and they are ready for the day. If you
Okay.
remember at that age too, everything is slowing down when you're over 60.
Okay.
So you don't need much repair and all that you need as a young person. But as a young
Okay.
person, 6 to 8 hours is recommended as good sleep that will make your body repair itself. When you wake up in the morning, you're emotionally strong, you are mentally sharp, and you can go about your daily activities. If you are having sleep less than 6 hours and you are not compensating, sometimes, excuse me, it happens. Maybe you got only 4 hours this night, okay, which is fine.
Mhm.
Tomorrow you might be able to get tomorrow night you might get 6 hours, 8 hours. But if you are constantly living on 4 hours sleep, like many people do in Lagos, okay,
Hmm.
it will eventually ruin you one way or the other, either physically and mentally or both.
Okay. It will ruin the whoever is taking the
It
sleep
will
is
ruin
not
the
that
person one way or the other.
adequate.
It will affect your health, physical health, and mental health eventually after a long time. Okay, people
Most
develop high
persons
blood
in
pressure, they develop heart disease, they develop diabetes, they develop anxiety, they develop depression
lack of
because
sleep you're talking of
lack of sleep will cause you all that.
will, will create all this.
It will
Oh,
create all this problem when if you are not having enough sleep. I know an individual I've worked with for many years in those days, very active, very good. He only lived like on 4 hours sleep. He developed diabetes,
okay.
and there's no history in the family.
Hmm.
Yeah, hypertension
Out
easy,
of
easy. You. I mean, within 1 year, somebody who have not been sleeping well will develop hypertension, high blood pressure.
hmm.
I've seen that so many times. And I've seen many people would start developing anxiety disorder, depression, because your mood will start changing. You become irritable and all that. When you, for example, you know yourself when you are tired sometimes and you don't have time
Hmm.
to
Hmm.
rest. If people are disturbing you, tell just leave me alone. You know, that's your mood coming up, becoming irritable
Hmm.
because you have not had good sleep. So
Hmm.
could you imagine you don't have good sleep consistently like that for weeks and months and all that? So things will start getting worse.
Which means we Nigerians may be getting it wrong. There's this belief that the less you sleep, the more hardworking you are. That a man who sleeps so much is a lazy person. But is there anything
Yes,
as oversleep?
I
Let me
remember
use
there's
that word.
there's a verse in the Bible that say, "Little sleep, a little slumber." So,
Uh-huh.
so shall poverty follow you like. But a
Yeah.
little sleep, a little slumber that is talking about, they're not saying you should stay awake and don't sleep. You still have to sleep. Even if you look in the books, if you look in the ministry of Jesus Christ, they say he went to somewhere and he rested.
Yes.
God rested on the seventh day when he was creating the heart. So we
Yeah.
need rest. We need our
We
sleep.
need.
We need it. If we don't sleep, eventually it's going to affect people. I encourage people to have enough sleep, or if you want to function really well and live longer, we need to go sleep. 6 to 8 hours for
Come,
young people, about 4 to 5 hours for older people.
Can we say that if you are not getting enough sleep, maybe psychologically now for some reason you are not just sleeping, something must be wrong with the individual, health wise and also mentally?
You're right. You're right. Sleeplessness is a disease condition sometimes. We call it
Hmm.
insomnia. Okay.
Hmm.
There are various causes of insomnia. Insomnia can be chronic. Insomnia can be, when we say chronic, it could be ongoing for a long time. Insomnia can be acute, which I mean is sudden and short time, and you fix it and then you can move on. But some people actually have chronic insomnia that they can't sleep. They just can't sleep because of an ailment. They probably don't even know what it is.
Hmm.
Physical problem can cause you not to sleep. Like if you have chronic pain, you have pain that never stop.
Hmm.
Have pain that never stop. That when you change position in bed, the pain come and wakes you up. Okay,
Okay.
that is caused by pain.
Hmm.
So what we need to fix in that situation is the pain.
Okay.
It's not the sleep, right? Once you are
Yeah.
comfortable, once you are comfortable, you might be able to sleep longer.
Okay.
That's a cause of lack of sleep. The second cause
Hmm.
could be psychological.
Okay.
You are anxious about something is coming up, or one have significant event in life. Maybe somebody dies, a loved one died, or somebody lost their job and everything. That will cause you sleepless night. Like you are
Hmm.
thinking, how will I fix this? How will I fix this? That is situational. That doesn't
Hmm.
mean you are not going to be able to sleep again in life. You're still going to be able to sleep. So how do we fix that? Sometimes when you talk to a doctor, they give you little medication. Even there's some over-the-counter medication you can take that are not addictive that will help you go to sleep. So that at least you get some rest. Even when you are thinking you are troubled, you are still grieving, or you're trying to recover from loss and stuff like that, you can still get some sleep. And once that
Okay.
situation get better, your sleep pattern will return to normal.
Oh, oh.
But what we call chronic insomnia, you might need to talk to a doctor to prescribe a non-addictive medication to help you
Hmm.
start sleeping, because nobody
Okay.
function well, nobody live well. The health, physical health, mental health will be affected if you're not getting adequate sleep. But sleeplessness
Okay.
by itself is a disease condition.
Okay.
It's a disease
Okay.
condition. Yeah.
Thanks. I remember in those days when we were quite younger, this drug Valium 5 or Valium
Yeah.
whatever,
Yeah. Yeah.
used by some of the elderly persons to sleep. Does that have an effect too? Because we're talking of clinical drugs now.
Drugs. Okay. Let's take opportunity to talk about those drugs. Yeah. You see, there are about two major type of drugs that people get addicted to easily. When I talk about getting addicted to medication in the beginning,
Hmm.
prescribed or prescription type of addiction, dependency and
Hmm.
addiction. Pain medication is one of them. Those pain medication, there's some pain medication like tramadol. Tramadol is pain
Okay.
medication. People start abusing it. But tramadol have a strong opiate base type of medication. We have some
Hmm. Okay.
medication that have codeine inside them. Strong
Okay.
amount of codeine. They're very good for pain. Tramadol is very good for pain. Those medications. So you see, these pain medications, they're supposed to be used for short time. Maybe somebody have surgery, or you have a
Hmm.
serious injury. They can put somebody on it just for 5 days,
Okay.
because In those days, we don't know this. We leave them on it for a very long time, and then they get addicted to it. So if the doctor is not giving it to them, they start buying it on the street.
Okay.
They start looking for it. That's when you know they become addicted to it. So pain medication is one. The second one is the one you just talked about. We call them sedatives, hypnotics.
Hmm.
These are the medication that we normally use to reduce anxiety when people are in serious anxiety state, and we give them sometimes for sleep. Because when you take
Okay.
medication and you are relaxed and all that, you fall asleep. You'll be able to sleep. So some of them
Hmm.
are sedative by themselves, some of them are sedative hypnotic. So let's talk about the Valium. Valium, I believe they would have taken Valium from over the counter in Nigeria now. Many years when I was in Nigeria, we buy it on the counter. You can walk into the
Okay.
pharmacy and buy Valium. The other one we used to
Okay.
buy is Mogadon. Mogadon is a sleep medication too. We
Hmm.
buy them. But those medications, either they prescribe or you buy them over the counter, they have very addictive tendencies. Okay?
Okay.
Because they make you feel so good, so relaxed that you want them. You want
Okay.
them. So psychologically, you'll be dependent, physically, you become dependent, and then eventually you do everything to get them, to make sure they're at home. Because, oh, I can
Okay.
sleep. Or if I can't sleep, I need to take Morgadon, I need to take Valium. Then you get addicted to it. Even if you don't have money to eat, you want money to go buy and keep it. Okay.
Okay.
But in
Hmm.
elderly people, when you say elderly, they are 65 and above.
Hmm.
To be honest, addiction is not a big concern when it comes to that age. What is our concern is for them to have good quality sleep.
Okay.
And they are grown enough, they have not have addiction. But if you have an elderly person that have past history of addiction, we don't give them.
Okay.
We would rather give
Mhm.
them something that is not addictive.
Okay.
We won't give them something like Valium. We call them the benzodiazepines. We will not give them anything that have benzodiazepines. Either it's Valium, lorazepam, clonazepam, anything pam 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 pam. We won't give them because they had past history of being an alcoholic. We won't. So
Okay.
we give them something else which are natural and they're not going to make you feel high. You probably won't like to take them if you don't need to take them. So there's some
Okay.
medication that will help them with sleep nowadays without uh, giving them Valium.
Okay. Okay. Thanks. Thanks. Then there's this new kind of way of life coming up in Nigeria now. The use of energy drinks
Mhm.
and alcohol. Would that
Yes.
affect mental health? They
To
mix it
start
together.
with, to start with, uh,
Hmm.
high use of alcohol will cause you some mental illness in the future
Okay.
if care is not taken. Anything
Hmm.
not taken in moderation become a problem.
Okay.
Alcohol have its own problem, and energy drink have its own problem. Definitely, my answer would be yes. When you combine both of them in high quantity, apart from your mental health, you are messing up with your liver and your kidney.
Hmm.
Okay? Because you see, all those substances, your kidney and the liver work very hard to get rid of
Hmm.
them from the body.
Hmm.
Once they finish the job you want them to do, then it comes
Hmm.
to your all these two big organs, the kidney, the
Hmm.
liver, to get rid of them. Otherwise, they will be toxic in your body if your liver and your kidney does not get rid of them. Okay. So it's a bad combination. If
Hmm.
people take it once in a while, like they want to have fun in the party, they want to stay awake and enjoy the party, and they just if it's occasional, it shouldn't damage you. But if it become an indulgence, you start using it constantly. Yeah, I mean, emotionally, mentally, physically, yeah, it will cause damages.
Yeah. Okay, let's start looking for solutions now. How do you think someone who's already addicted can get out of it? What are the processes?
Yeah, the process is, I mean, there's no simple process. The last time I talked about it, I told you prevention is better than cure, don't do it. Okay? So, number one is prevention. But when it has occurred, especially our parents need to watch their children when their
Mm,
behavior start changing.
mm,
You know your child and you find out that the behavior is changing, the grade is dropping in the school, it's not the usual person you know. You need to have a
mm.
conversation.
Yeah.
What is the problem? What are you using? What are you taking that we don't know? Be upfront about it.
Mm.
So this starts with conversation.
Okay.
It's not common you see anybody that is overusing a substance or addicted to a substance. It's not common that they will say, yes, I have problem. It's going to
Okay.
be people around them, the parent, the family, the friends who identify that problem first, that you have a problem.
Mm.
So that's why I said we start with conversation. They will
Okay.
say, no, 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 I'm just fine. Nothing is wrong with me. Then you present them with the fact that,
Mm.
so date, you said this. And when I look into it, I find that was not true. What were you trying to say? I
Mm.
mean, what was your reasoning at that time? Just to help them, you know that they're getting in trouble. Maybe,
Mm.
honey, hey, our rent has been due. Baba has been knocking on the door. What's happening to the money? Because this doesn't happen. You still have the same job and all that, and you are not having enough money. So we start with
Mm.
conversation. So once we have the first conversation, the next thing is that there are different services back in Nigeria and everywhere in the world
Mm.
that we call the addiction recovery services. Okay,
Mm.
usually it's run by psychologists or psychiatrists most of the time. So the first thing is that we take them for consultation with these people and say, okay, look, this is what we are observing. We might be wrong. Could you look into it and help us and identify? I'm talking to my
Mm.
boy. He's saying this, no problem. So once you go to that clinic, they will do urine test.
Mm.
From the urine test, we're going to know what drugs you've been taking.
Mhm.
Then we'll have a fact and say, hey, you said there's no problem. This comes out in your urine. How long have you been using this? How
Mm.
frequently are you using it? How are you getting it? So we
Mm.
do a comprehensive assessment. And why do you think you need it? That's where the recovery will start. So
Mm.
the person will be allowed. I mean, there are different programs. Some of them run between 6 weeks and 3 months for recovery,
Okay.
you know. And it always give people chances to understand why they are using, why they should not use any longer. That's basically what they teach them there. Okay.
Mm.
If they need medication, and we have medications too that help curb what we call craving of the medication.
Mm.
That's part of the recovery program. They will prescribe them so that if you are craving, oh, I must drink. Oh, no, I need to smoke. No. There's some medication that when you take them, they reduce that urge
Okay.
to do the compulsive behavior. So there are a
Okay.
lot of help out there. The first
Mm.
thing is to be able to convince the person, let's go.
Mm. Well, I want to thank you for that advice. What advice I know you have advised them countlessly. Don't even touch it. Don't touch it. Don't touch it. Then, because I met a lot of parents who some fathers who are even in tears,
Mm,
crying when their son is into one drug or the other. How can you advise those parents to at least detect whatever maybe the son or daughter may be taking? And also, what could that parent do to find a solution finally? I know you mentioned, if you can also add to it.
Well, for parents, one, I know nowadays we're very busy. We have businesses to attend to. We have jobs. We have a lot of other things.
Mm,
I know we are not as involved with our children as we used to be.
mm,
Not like our parents used to be around us. So we need to pay
mm,
attention to them when they becoming teenagers. We need to pay attention to those
mm.
friends they're hanging out with. You need to know them. You need to
Okay.
know because most of the problem doesn't come from home. It comes from outside when people convince that, this is no big deal. Let's just smoke it and all that. So, peer pressure. We call it peer pressure. They need to look at peer
Mm,
pressure and try to be present in the life of their children. Do not let
okay.
activities outside the family take a lot of your time away. Find time at least twice a week to have some funny conversation or some to bring your child closer to you. That's one. And once you find out that, as I said, if you start seeing changes, jump quickly.
Mm,
Get into conversation, confront the child, say, hey, I don't know if I'm wrong, or this is what I'm seeing. You're spending too much in your room nowadays. You will lock your door.
mm,
You never lock your door before. So what's going on? That's true. If they still live in your house, you need to put the rules down clearly. That if you are still living in this house, you follow my. So that is called boundaries. When they go to recovery too, we put boundaries. That's where the
mm,
we always put a lot of rules and regulations, so you can start that at home. Then once you know that there's something wrong, as I said, quickly take this child to see a professional. They have the skills to talk better than what you talk. They know how to
mm.
get things out of them. Then the recovery process can start that way.
Okay. Okay, thank you, Prof. We have really been able to, and I know this is on YouTube, so many persons would consult it, and you have even given us free consultation that I hope parents and also the youths themselves would learn from it. And it's my prayer that none of us gets involved in any form of addiction. Thanks, Prof. Okay,
You're welcome.
bye. Yeah.
Bye.